Good morning. Welcome to A Business Owner's Guide to Selecting a Group Health Plan. My name is Mark Schwartz and I'm joined by Tara Brady. Our agenda today: why offer a group health plan types, health plan terminology, rating methodologies, metal categories, employer contribution, premium cost saving strategies, and then we'll finish with the question and answer period. Why should you offer a group health plan? As a business owner, you already have multiple expenses. Why offer a group health plan?
Well, one reason is that according to the Affordable Care Act, otherwise known as the ACA employer mandate, applicable large employers, ALEs, are organizations with 50 plus full-time and full-time equivalent employees, and they are subject to an excise tax if one or more employees qualify for premium assistance and the employer fails to make an offer of group health plan coverage to at least 70% of its full-time employees and their dependents. And the penalty for that is $2,000 multiplied by the number of the employer's full-time employees. Or if the coverage offered is either unaffordable, or fails to provide minimum value. And the penalty for that instance is $3,000 multiplied by the number of the employer's full-time employees who qualify for premium assistance.
Small group employers with up to 50 full-time and full-time equivalent employees are not required to offer group health coverage to their employees. However, should they elect to offer coverage, small group employers must abide by ACA rules regarding provisions of minimal essential coverage and minimum value.
In a competitive job market, savvy employers know that a strong group health plan is a valuable tool to attract qualified candidates. After wages, employee benefits are often the most important consideration to most prospective employees.
Employee retention. High employee turnover incurs repetitive expenses, such as continuous recruiting, frequent onboarding, and ongoing training. These soft costs arising from high turnover are low employee morale, increased workloads for remaining employees, and decreased efficiency due to repeated training of new hires. A robust group health plan can be a deciding factor in retaining your valued employees.
4 main types of group health plans are an HMO, which is a health maintenance organization, an EPO, an exclusive provider organization very similar to HMO, POS, point of service, and PPO, preferred provider organization.
HMO and EPO plans, there's typically no coverage for out-of-network care. There are some exceptions for emergency care, however. They require a PCP, also known as a primary care physician. Gated plans require PCP referrals to see specialists. Open access plans, however, do not require primary care referrals to see a specialist. They may offer a more limited choice of network providers, sometimes require members to live and work in service areas. They generally have lower out-of-pocket cost and also lower monthly premiums.
I have a brief intermission here. If anyone has their phone unmuted, if you could please mute it, we can continue with the presentation without static. Thanks. POS and PPO plans provide coverage for out-of-network care, but at a higher cost to the member. They usually do not require PCP referrals to see a specialist. They offer larger provider networks, and they generally have higher monthly premiums than do HMOs and EPOs.
Please refer to the health plan comparison chart. This is a basic summary of the 4 types of plans: HMOs, EPOs, POS, point of service, and PPO. Five major health plan components. Premium, which is the dollar amount paid by the insured in periodic installments, typically monthly, for coverage under the health plan contracts. Deductible is the dollar amount the insured must pay out for covered services before the insurance carrier will make policy benefit payments. expressed as individual/family deductibles. A plan may include several separate deductibles, including in-network medical deductibles, out-of-network medical deductibles, and also prescription drug deductibles.
Coinsurance is the percentage of covered expenses that the insured must pay out after any applicable deductible has been satisfied. The insured will pay a higher coinsurance for out-of-network services. Copayment, or copay, is a fixed dollar amount which is paid by the insured for a specified covered service, such as a physician's office visit or a prescription drug refill.
What we typically stress is the most important of the 5 components is the out-of-pocket maximum. This is the predetermined maximum dollar amount the insured will pay out in deductibles, copayments, and coinsurance for covered services provided during a plan year, after which the carrier pays 100% of the allowed amount for these covered services for the remainder of that given plan year. There is a separate out-of-pocket maximum for out-of-network services. Not included in the out-of-pocket maximums is premiums, charges over the carrier's allowed amount for covered services, and charges for non-covered services.
Rating methodologies. Member level age rating is the most common rating structure for the smallest groups. Premiums are assigned based on the age-based risk of the members. This method is a benefit to younger employees who receive lower rates. The oldest employees and dependents pay the highest premiums.
Generally, a lot of employers prefer, when they can, to go to composite rating. This is commonly also referred to as tiered rating. Examples are employee only, employee and spouse, employee children, and family. These premiums are based upon a group's average risk profile, which is determined in part by business type, location, and group demographics. All the employees pay the same rate for each specific tier of coverage, thereby spreading individual risk evenly between all enrollees. This rating methodology benefits older employees. Depending upon group state situs, which is their location, and carrier, this rating system may not be available to very small groups.
As a result of the Affordable Care Act, the health insurance marketplace was established. In order to standardize plan coverage offerings, each health plan offered is ranked based upon the level of coverage it provides. ACA-compliant plans are sold both on and off the marketplace using these rankings. The 4 levels of coverage offered designate actuarial cost-sharing values and are often referred to as metal levels. Bronze plans offer the lowest premiums but the highest deductibles. They pay the lowest overall portion of costs once the deductible is satisfied. They're a good choice for members who have no ongoing health issues, who do not anticipate regular medical services, and who do not regularly take prescription medication.
Silver plans, members who purchase a marketplace plan and who qualify for extra cost sharing reductions, usually due to income levels, can only receive the cost reductions if they enroll in a silver plan. Members who do not qualify for cost sharing reductions should compare silver and gold plans to select the plan with the best benefit and cost combination to fit their needs.
Gold plans have higher premiums but lower deductibles. They pay a greater portion of covered costs once the deductibles are satisfied. Members who anticipate frequent doctor visits and or regularly need prescription medications should consider these plans.
Platinum plans they offer the highest premiums and lowest deductibles, if any at all. They typically pay the highest portion of covered costs once deductibles are satisfied. Members with chronic medical issues and ongoing prescription medication usage, we highly recommend these are the type of plans we set you up with.
If you'll take a moment to look at the metal level chart, it basically is a summary of what we've just gone over about the different plan levels, the cost to purchase versus the health plan responsibility and the patient responsibility. I would like to point out that the health plan responsibility is actually calculated in terms of the metal level by the actuarial value of the plan. Now, the actuarial value is the percentage of healthcare costs for which a healthcare carrier is responsible for paying. And that's versus the percentage in cost sharing to be paid by the insured in the form of deductibles, coinsurance, and copayments. The percentage a plan actually pays for a given service will depend upon the cost of the service, the type of the service, and so it will usually be different than the actuarial value. In general, the higher the actuarial value, the lower the cost sharing that will be required of the insured.
Employer contributions. Employer contributions towards group health plan premium is subject to minimum requirements. The Affordable Care Act stipulates that the employer must contribute a minimum of 50% of the employee-only premium for the lowest cost group health plan being offered. Most group health carriers require a minimum employer contribution as well.
In order to be competitive in the labor market, an employer must be willing to consider contributing more than just the minimum. The employer's contribution toward health premium should take into account the group size, the industry, the number of years the company has been in business, and the expected turnover.
There are multiple premium cost saving strategies. High deductible health plans, with the plan premiums increase as deductible amounts decrease. An employer may elect to offer a high deductible bronze or silver plan to their employees. To offset a high deductible plan's financial impact to employees, an employer may consider establishing an account to assist employees with deductible expenses.
A health savings account, or HSA, is a tax-exempt account allowing tax-free distribution to pay for qualified medical expenses incurred while the employee is enrolled in an HSA-compatible high-deductible health plan.
Established by the employer or the employee, HSA plans are funded by pre-tax employee payroll deduction and employer contributions, which are excluded from gross income. Employer contributions are generally not subject to employment taxes.
A health savings account requires that an enrollment in a qualified HSA-compatible high-deductible health plan, and the health plan must have in 2019 must have a minimum annual deductible of $1,350 individual deductible and $2,700 family deductible. The entire family deductible must be satisfied before any plan benefits are paid out for any enrollee or their dependents. Employees who are enrolled as self-only must meet only the individual deductible. All covered services are subject to the deductible, including office visits and prescription drugs. The only exception is preventive care, which is, according to the ACA, must be covered at 100% and is not subject to the deductible.
Health savings account advantages. The funds belong to the employee upon deposit, and funds are portable, meaning if the employee leaves the employment, they can carry that money with them. Disadvantages. Funding can also be a hardship for lower earning employees if the employer is not contributing. And if the employer is contributing, employee can leave employment and employer contributions belong to the employee.
The Health Reimbursement Account, or HRA, is a tax-exempt account which allows tax-free distributions and reimbursements to pay for qualified medical expenses incurred while the employee is enrolled in a group health plan.
HRAs are established by the employer and funded by the employer. The funds technically belong to the employer. If an employee terminates employment, unused funds remain in the HRA account owned by the employer. Unused employer contributions can be rolled over at the end of the plan year to fund the next year's contributions. This must be integrated with the group health plan, and there's no minimum deductible required.
The advantages of an HRA include the fact that the funds belong to the employer. The employer contributions are not subject to employment tax, and the employer contributions are excluded from gross income. The distributions are not taxed if they're used to pay qualified medical expenses.
Multiple plan offerings. One way we can save premium costs while still offering richer benefits to employers is to offer a second plan in addition to high deductible plans. The high deductible plan would be the base plan, and the lower deductible plan will be considered the buy-up. Employer contribution is based upon the high deductible plan premium, and employees therefore can buy up by paying the premium difference in addition to their cost.
In conclusion, we have addressed topics including why offer a group health plan, the types of group health plans, health plan terminology, rating methodologies, metal categories, employer contribution as both a requirement and as a recruitment retention tool, premium cost savings and methods, but most important is a successful balance of employee needs with your business goals.
If anybody would like to ask some questions, we have some time available to answer some questions. Okay, if there are no further questions, always remember we're here to help you. If you want to reach out for a conversation, we can talk about your benefit needs. info@excelhr.com, or you can reach us by phone 301-340-3800. Our next Excel-Eventbrite.com webinar will be on Wednesday, April the 10th at 1 p.m. on how to manage disruptive employees. We thank you for joining us. You have a great day.